Good morning, everyone, and thanks very much for joining our webinar this morning, Attracting and Retaining a Thriving Social Care Workforce. So my name's John Wilson. I'm the CEO for Totaljobs Group, and we're working in lockstep with the Work Foundation to bring you the webinar this morning, but also the report into attracting and retaining talent in the care industry. As a business ourselves, obviously we help people find jobs and we help companies staff up for success. And operating in the care sector is a massive part of what we do. And we've run a number of research reports previously over a number of years to help understand what are the issues and the challenges that our customers are facing and that workers in the industry are facing, just to help us look after our customers, but also make sure that we're flexing our approach ourselves to help people find those jobs. We work directly with customers like Care UK, who you'll hear from Victoria today on our panel, who's talking with us, as well as I say, the Work Foundation. And this year, we're also supporting the DHSC's Every Day Makes a Difference recruitment campaign. So that's us, and that's why we're here. We're going to hear from some great panelists at the end of the report, and I'll introduce Melanie in a second, who will take you through it. But we'll hear from Victoria Cole, who's Head of Resourcing at Care UK, Roger Williams, who's the Senior Policy Advisor at Care England, and Jay McKenna, who is Policy Officer at the Trade Union Congress. So hopefully, regardless of what area of the industry you find yourself, you will get some good information today. As we delve into our research into the social care sector, we're going to share employer, employee, and policy perspectives. The findings that we've got, they point really to a workforce that's continuing to face substantial challenges, not least in terms of the T's and C's, but also just the dissatisfaction that some workers feel, but actually, practically, what can we do about it? So we're thinking about the challenges within recruitment, retention, and progression. And I think we'll round off with some suggestions around government sector bodies and how they can address these, as well as what we can do as employers and recruiters to address that. The webinar itself is recorded, so it'll be shared with all of you afterwards, and also so will the report. And if you want to forward that on to colleagues or people in your business, then please feel free to. So that's, I guess, enough waffle from me. So at this point, I will hand over to Melanie, who will take us through the report. Over to you, Melanie.
Thanks, John. So I'm Mel Wilkes, Head of Research at the Work Foundation, and we're really pleased to share the findings of this work with you all today. So the Work Foundation is a think tank for improving work in the UK. We belong to Lancaster University's Management School and have been an independent source of ideas and analysis on the labour market for over 100 years now. This project was conducted by a team across both Totaljobs, as you've heard from John, and the Work Foundation. So colleagues of mine on the call, Trinley Walker and Olivia Gable, contributed a huge amount of work to getting this together. In terms of what we did, we used a mixed methods approach to understand the barriers to recruitment, retention and progression within social care, including a review of existing evidence, interviews with stakeholders and employers in the sector, and two surveys. Two surveys of Totaljobs candidate database. One of those was a survey of people currently working in care, which received more than 1,000 responses, and another survey of individuals who either aren't currently in work or are based in other sectors to understand more about perceptions of work in adult social care. So I'm just going to walk through our findings across those three core pillars: recruitment, retention and progression, before handing back to John to talk about some of those practical recommendations for employers. As many of you will know, there are long-standing attraction and recruitment challenges in adult social care. Turnover is high and many vacancies go unfilled. A core driver of this has been negative perceptions of care work, but there are positive indications from our research that attitudes towards work in care are improving. More than half of the candidates we surveyed indicated that their views of adult social care have become more positive. Roughly a third of candidates indicated that they've considered working in adult social care, and among them, young people were particularly interested, with 73% stating that not only have they considered working in care, but that they're actually quite likely to act on that and pursue a career in the sector in the near future. So we'd really like to see providers and sector bodies seize this opportunity to think about how they can attract this group to the sector. Can we have the next slide, please? But crucially, we found that misperceptions about routes into the sector could be presenting a barrier to recruitment. Nearly half of respondents to the candidate survey indicated that they wouldn't work in social care because they didn't believe that they had the qualifications that they needed. In fact, as many of you will know, entry-level care roles often don't require specific qualifications, with training and support provided to build up the expertise and skills needed on the job. So there's clearly a role here for outreach and engagement to kind of tackle those misperceptions and beliefs and build up a better understanding about routes into care work. We also found that low pay can be a barrier to attracting candidates. 38% of respondents to the candidate survey selected pay as a reason that they wouldn't apply for a role within the sector. Could we have the next slide, please? Now, there are 122,000 unfilled vacancies in social care. High turnover and regular use of agency staff are bringing significant operational staff costs to care providers, but crucially, they're also impacting the quality of care and support. Co-production is at the core of how we understand modern care services, with the person who's receiving care at the centre of decisions about the support that they receive. But as we found through this research, in practice, it's very hard to deliver care of that kind under these very high pressurised circumstances. In truth, it really hinges on establishing a long-standing relationship between the team providing care and the individuals receiving it, and that's just very difficult to do in the context of high turnover. Another core area that we explored through retention is mental health and wellbeing. Some of you might have seen that just this morning, the Health and Social Care Committee published a new report which described burnout in health and social care as being in a state of emergency. And that really was mirrored to some extent through our research. So we asked candidates about their current mental health and mental health a year ago, with just less than half reporting good mental health currently. So there's a clear role here to think about supports to manage wellbeing, particularly during periods of acute workplace stress, such as the pandemic that we've been experiencing. Otherwise, there's a real risk that without this kind of safety net, we could see retention of expert and skilled care workers being jeopardised. Now, 37% of care workers we surveyed are currently looking for a role within the sector, so moving from one role within social care to another. For them, the main motivations are wanting higher pay and not feeling sufficiently valued. But alongside that was not having sufficient opportunities for progression. For the 14% of care staff who were actively looking for roles outside of the sector, there were some similar key drivers. Again, higher pay, and again, not feeling valued were the two main reasons. But alongside that was wanting a less stressful working environment, which mirrors what we were just talking about there in terms of that stress and burnout that some people are experiencing. But feeling valued was a thread that ran through the research, both as a challenge for people that are currently in the sector and for those who'd recently left. We found that respondents who disagreed with the statement, "My employer values the work that I do," were 1.5 times more likely to be planning to leave their role compared to other respondents. Finally, then, we looked at progression and found that a lack of funding and resources, a limited differential in pay between those working at the entry level and in more senior roles are both limiting opportunities for progression in care. Alongside that, in England and Wales, the absence of a standardised and portable training and qualifications framework for care workers was also a key problem. As you might expect, opportunities for development and progression have been limited in the context of the pandemic, with a third of workers reporting that training had reduced over the course of COVID-19. And providers we interviewed again echoed that, talking about the challenges, for example, of offering work placements in the context of recent circumstances. But again, we know that progression is key. So workers who agreed with the statement, "I don't feel that I can progress in my career," were more than 2.5 times more likely to be thinking about leaving social care than others. So there's a real challenge in that, in terms of being able to offer a long-term set of kind of career prospects, despite the current challenges around training and learning and development. Care workers told us that in particular, they'd like access to training that would enable them to provide more specialist support to people with specific needs. There were a range of themes that came up here, but in particular, we saw individuals who self-harm, as well as specialist support around dementia, autism, and personality disorders as recurrent themes that were being raised by respondents to our care worker survey. So there's clearly a need here, well, an ambition among care workers to develop specialist skills and support. I think a challenge that we recognise is that the care sector is often quite flat. So opportunities for progression might not be immediately apparent, but there's an appetite among care workers to develop specialisms, and we're interested to explore whether that might be a route to unlocking opportunities for progression within the sector. So I'll briefly share our policy recommendations before handing back to John. As I've outlined, over the course of the pandemic, adult social care has been positioned in a different light. It seems greater numbers of young people are considering care as a career path. Those already working in the sector have told us that they're proud of the jobs that they do, and many would like to forge a career over the longer term within adult social care. But to unlock that potential, we need to see meaningful government-led reforms to tackle those perennial problems, including pay and progression, in order to give care providers the certainty and stability that they need to develop their workforce. So our first recommendation is lending our voice and support to a recommendation that many others are making, to see government deliver on their commitment to reform social care and provide long-term stability and workforce strategy. But crucially, alongside that, we're acutely conscious of the role of sector bodies within the devolved nations in supporting innovation and operational delivery within adult social care. And so we'd like to see sector bodies working together with employers within the sector to develop a CPD framework and a long-term strategy to unlock opportunities for training and development within care. And crucially, alongside that, we need to see funding to cover the direct and indirect costs of training embedded into care contracts to really free up those opportunities to build new skills. So those are the policy recommendations, but ahead of any kind of long-term policy reforms, there are a range of ways that we've identified that employers can improve their practice or drive innovations in their practice to try and tackle some of these challenges across recruitment, retention and progression. So I'll just hand back to John to talk those through with you now.
Great. Thanks a lot for that, Melanie. And I think that there's some really insightful information there that I hope, of course, I know, when we get to our panel conversation in a second, we'll be able to tease out some more detail around there. And obviously, if you're watching and you want to ask a question to any of the members of our panel, then feel free to pop the question in, and we'll try and get through some of those as well. So I think alongside policy and the wider sector approach that Melanie walked through, clearly there's a lot that employers can do to make sure that their care workforce is thriving. And I guess a lot of the things that we might talk about and recommend, and again, we can discuss in more detail after this, are probably not unique to the care sector, but they're certainly acute here and in an industry and a sector that is that needs stability. Then I think there's more impact to be had. The idea of feeling valued, it came through really strongly in the research. When we talk to people about what is the most likely reason for them to leave the industry, the second most likely after pay was, feeling valued. When you talk to people who've already left, actually the most prominent reason was feeling valued. So really and truly, like, this is where, as an employer, focus in this area could have some real benefits. Clearly, that will very much depend on your own situation, and I guess as you go through the research, you'll pick out the bits that resonate specifically for you and your business. But it's certainly incredibly prominent, and it's something that as an employer we can do something about. I think part of that starts then from getting to know your workforce, and particularly those of your workforce that are longer term and engaged and are working with you for a longer term. I think we've started to do some work with some of our customers where we look at the psychometric profiling for those staff to help businesses hire people who have the same skills, or at least the same style, if you like. And I think speaking to people is that they want more managerial support, more independence in communication. These sorts of things are really, really solvable. And I think when we think about just that kind of engagement piece being such a large driver, the other thing that Melanie touched on a lot is around staff well-being. And clearly in the care sector, then well-being is something that's permanently there. And I think, making sure that there's the ability essentially to have a check-in where you can track over time how employees are feeling really, really helps to make relevant changes to the team that you have on the ground. Training for managers as well is a critical one, so that they can really support their teams. We also saw that a very, very high proportion of young people are considering or would consider working in the care sector. And I think in thinking about that is how do we attract people? And one is about making it clear about what's required to actually work in the care sector. But also I think what goes hand in hand with that is, creating workspace or work experience opportunities for young people so that we can help develop a pipeline, working closely with sector bodies in your area, like colleges and schools, local authorities, and then aligning on some of the national campaigns, such as the DHSC's Care for Others and Make a Difference campaign. I think all of those things can help. At a practical point, I kind of thought, well, what are we seeing in the data from a job board perspective that might help shed some light? We have market insights where we looked at just over 15,000 care sector candidates across 5 major organizations. And what we can see in the data there, that 56% of people who moved into social care roles in a 2-year period, they had moved from a totally different sector. So we're seeing a lot of influx, which means that values or skills-based recruitment is a critical thing to get right and understand. Like, where are the people coming from? What are the skills and values that make sense? So things like patience, compassion, good listening, organizational skills, those things rate higher than qualifications or experience in a lot of instances. We also see that 44% of people who then leave their care job actually move to another care job. So it isn't, what we're not seeing is a like-for-like revolving door where people are coming in and going out. People are coming in and they are moving a lot within the industry, but they're moving a lot within the care sector, and most likely that's going to be a local provider to wherever your business is located. And so I think this is why it's really important to understand, you know, who else is operating within a local catchment area. How do you compare, or at least ways, how can maybe somewhere like Totaljobs help you understand that if people are coming into your business and going out of your business, where are they coming from, where are they going to help understand, well, what are the insights that can be derived that would help your business specifically, and very possibly you can derive that yourself, or certainly with support from Totaljobs or another recruitment provider for sure. But I think the important thing is people are coming into the industry. It's predominantly from roles like customer services, like sales. And then when people are leaving, they are a lot of time staying within the industry. So it's really about how do we retain those individuals. And obviously we've talked about a number of things that are drivers for that. So I think that's probably where I'd stop from my perspective. So more than happy to have more of a conversation about that in the panel, which is perfect timing. So at this point, Rodri, Victoria and Jay, if you wouldn't mind popping your cameras on and taking yourselves off mute. Great, see you there, Rodri. Hi Jay, hi Victoria. Listen, thank you all so much for joining us today. It's really, really appreciated. Victoria, if you wouldn't mind, could I pass to you, and then maybe you introduce yourself and then hand off to Jay, and then Jay, you hand off to Rodri, and then we'll get going.
Yeah, sure. So hi everyone, I'm Victoria Cole and I'm the Head of Resourcing at Care UK. I've been at Care UK 8 years. It was my first role in social care. I progressed my career at Care UK and I'm really pleased to be here today.
Great. Jay.
Yeah, my name's Jay McKenna. I'm the Policy Officer for the TUC, responsible for social care. I haven't been covering this role as long as Victoria. I've been covering it for around 6 months, but it's been a really interesting learning curve. Really, I think everything I thought I knew about social care, I didn't, and everything I didn't know has been heartening to learn, particularly conversations like this around kind of how we improve things for the workforce, working within social care, and how we get a social care system that we want and deserve in this country, which is really important. That's where lots of our work fits to, about improving standards for those who work in social care, but ultimately what this is all for, those who receive and rely on social care in this country.
Yeah, excellent. Thanks, Jay. I think obviously fresh eyes are always helpful. So obviously you've been in the sector for 6 months, but I'm sure a lot of initial insights to share. And Rodri, please.
Hello, I'm Rodri Williams. I'm a Senior Policy Advisor at Care England. Care England is the largest representative body of care providers in England, and the work that we really try to do is campaign on behalf of the sector, as well as creating linkages within the sector, because I think for so long it's been a disparate sector, and I think part of our role is proliferating best practice between different parts of the sector and ensuring different parts of it are linked up. And throughout the pandemic, we've been campaigning on behalf of the sector for the requisite government supports to be put in place for it. So happy to be here today and contribute to this report.
Great, thanks Rodri, and for all the work that you guys are doing to essentially pull together, as you say, a disparate industry. Victoria, if I start with you, let you get a drink of water there. We talked a little bit about some of the evidence that we're seeing, that the perception of social care, it really is improving, but along with that, there's a lot of misconceptions about entry requirements for care work. So I guess it's like, how do we leverage one? You know, we got this positive attention. So how do we leverage that to develop a greater appetite for working in the sector when we consider that, you know, as I say, there is that misconception around entry requirements and what have you? What's your thought there?
Yeah, sure. So I think for me, it's about giving our colleagues a platform to tell people what a fantastic career can be had. And you often hear it come from employers, but actually coming from the horse's mouth is far more powerful than any employer can do. And we really need to showcase that care is for everyone and shout about the success stories from a variety of different cultures, age groups, backgrounds. And I think there's a few ways in which we could do that. So I think one really important factor to consider is schools and colleges and that generation to see that social care is a career of choice. I know when I was at school, I had a perception of care. I don't quite know where it came from, but it was negative. I either didn't really know that a care home existed, or when I did, I had a negative view. And as I say, I'm not entirely sure where that view come from. So kind of educating at that really young age, and KUK have done some work with local schools and colleges in some of the areas where we have homes to really try and get through what are the career opportunities. And John, you talked about the progression being a really big factor. And I know, for example, that 36% of our home manager population have been internally promoted. And these are manager level roles with good level salaries. So there is such a really great career path to be had. And I think all the great things actually do go on. And it's about educating that age group at school, college level to really showcase what a fantastic career it is, B, what the career involves. So what's the day-to-day job involved? I think actually a lot of people that we speak to don't quite know what they're getting themselves in for. There may be a perception it's personal care, but the job is so much more. So for me, it's about educating at that really young age, actually, what a great career it could be.
That's cool. Roger, I saw you nodding your head a lot as Victoria was talking. What's your thought here from the experience that you've got? How do we kind of take this positivity and actually encourage more people into the industry?
Well, I think reports like these are really important. I think in the past there has been somewhat of a research deficit when it comes to the adult social care sector. And also another important element I think that we've tried to stress is emphasizing the nuanced and varied nature of the sector. So when you look at the different job roles, which are a reality within the sector, the fact that you can be an auxiliary staff member, a care home manager, a support worker, and a registered nurse, and emphasizing that diversity to people who might be looking into the sector actually opens it up for those individuals. And I think too often in the past there's been this negative perception that the adult social care sector is just one great mass of 1.6 million support workers, and instead we need to show the diversity of the sector and the fact there's a range of different care models within that. So you have rehabilitative care, you have learning disability care, you have older persons care, and again, too often in the past there's been this negative perception that simply older persons is what adult social care is dominated by. And I completely agree with Victoria's point about emphasizing the success stories. So when you look at individuals like Kate Taroni, the chief nurse for adult social care, the chief inspector at the CQC, she started off as a care worker and built her career within adult social care. So we need to emphasize those success stories in order to show that there are routes for progression within the sector.
Yeah, I think that's really valid. I guess the challenge is like, how do you get that message out when you are a disparate sector, if you like? Jay, I know you're like brand new into your role, but do you have an insight here that you would like to add?
I think I'd agree with lots of what Rodri and Victoria have said there. That this is Roger mentioned the size of the adult social care workforce. That's bigger than the NHS. And would we all sit here and look and say that adult social care is seen in the same way that most in this country would look at the NHS? Is it spoken about by our politicians, by our policymakers, by other decision makers in the same way? I don't think it is. And I don't think amongst those who might want to come and work in the adult social care sector, those who rely on adult social care, it's not seen the same. I don't think there is that parity. We certainly feel the same across workforce issues. So I think that's really important. But it is interesting in this research, I think, and again, Rodri alluded to this, more data is really important to understand these issues. This has confirmed some of the things I thought and knew about social care. It's highlighted new ones, that there are people interested in coming to work in these jobs, but why don't they stay? What are those issues? And I think in the last year, the pandemic has caused a great many problems, but there are opportunities that have come out of that. And that, I think, is that there is a recognition and an understanding of social care that's greatly improved than where it was before. I, like Victoria, had a vision of older adult care based on the care my granddad received, based on the sheltered accommodation he lived in. I thought I knew what it was. It isn't. It's very varied, as Rodri and Victoria have said. There are opportunities for people, and I think now we should be in a place, certainly after the last year, where we've valued, we've clapped, we've acknowledged, we've seen, and I think we all accept now we cannot live without the important workforce within adult social care. We rely on them greatly. It's now what we do next, and I think this report is a real good kind of focus on lots of that look like individually small issues, but I do think come together. How you recruit and retain staff is the same thing. Pay comes up, quality of jobs, kind of explaining to people what this job is, making them understand and be aware. You look at the retention rates that Skills for Care publish. People do, when they come into the job, are likely to leave within the first year if they're going to leave. Well, why is that? Have we properly explained what the job is? Have we recruited, values-based recruitment? Have we explained what that is? Are there ways we can improve that? And I think this is where I think we find ourselves on social care now, that we see there is these challenges, issues, problems, depending on how you view them, but there is an opportunity, I think, to fix some of these. And the report touches on lots of those, and I think now it is about saying to people, well, okay, we can fix some of these as employers, as organisations working in the sector. There's some things government need to do, but collectively, I think that's important. It's something the TUC have called for, a national care service, Scotland are having this conversation, but a body that can come together and acknowledge all of these issues and challenges and say, right, okay, what do we do about it? How do we put our collective thinking together? And I think that's where there's something missing when we have that NHS comparison. There are policy makers and decision makers in government who fund the NHS, but then there is an organisation that can kind of take forward lots of these changes, whereas, as Rodri rightly points out, it's very disparate. And I think that makes it challenging sometimes, that some can go off and do some of their own thing, but are we sharing that good practice? Are we learning those lessons, good and bad, across the sector? I'm not quite sure we are yet, but there is clearly lots of will, and that's one of the things I touched on before I find really heartening. Everybody acknowledges the same issues and everybody is wanting to move this forward. The only people not at the moment seems to be government, but I think we're hopeful and confident that we can push them in that direction to get the changes we want and need.
Yeah, I think the positive sentiment that we've touched on, certainly as a recruitment business, we see that across the board. Actually, there are less candidates on the market today than you would expect at this time of the year in a normal year. So I think partly that is about government programs and furlough schemes, etc., that are probably slowing people's return to the market. But interestingly, care sector is one of the areas that does see relatively buoyant levels of application. So there's some there's some positivity here, again, that we touched on before. But all three of you touched on the fact that the sector is seen as low skilled. So Rodri, if I pointed at you, we obviously know it's not the case, but like how do you challenge that? How do you create? So Jay, you mentioned, maybe the NHS is seen as in a different light to what the care sector is seen. So how do we promote a more kind of professional view, Rodri? You've spent some time in this area?
So I think at Care England, from a sort of trade association and representative body point of view, I think it's about often establishing a more collaborative relationship with the media. I think in the past there's been a negative perception amongst journalists, and it's actually about educating some journalists when it comes to adult social care and the merits of it, because I think in the past adult social care and the media's perception of it has been completely tainted by the likes of Wharton Hall and the worst cases within care. instead we need to counteract that. And I think that has been done in the pandemic. We've certainly built greater links with journalists. I think also it's about, when COVID allows, it's about opening up care services and allowing, for example, day services, being innovative when it comes to the commissioning of care, and allowing people to come into care services, because I think in the past there has been a perception that care services have been almost separate from communities, and if we open care homes and care services to communities, then surely that will generate greater understanding. And I think also it's about, as everybody else talked about, it's about getting people, establishing links between educational institutions and care homes. But I think lastly, I think one really important aspect is emphasizing the human rights ideology that is behind the adult social care sector. And adult social care has been at the forefront of pushing notions of person-centered care. And if this is especially important for younger people, I mean, notions of equality are particularly important to young people at the moment. And if we can be innovative in how we link into these debates, that's surely got to be a positive thing, and people recognizing that adult social care is actually perpetuating human rights and equality within society. Especially learning disability services have been at the forefront of that.
Yeah, and I think the idea of meaningful work is becoming much more prominent in what people are looking for that fulfillment, which I think speaks to a lot of what you said, Rodri. Victoria, what does this look like in real life? So you mentioned that, you know, there are some really great managerial roles as well as all sorts of different types of roles in care. How does this play out for you in day-to-day business when you're trying to, I guess, explain the professionalism and the diversity of opportunity that's within the sector?
Yeah, I actually think, looking at this from an employer's point of view, one way to promote the professionalism of the sector is actually through apprenticeships. So historically, so society has always had a really inaccurate image of what an apprentice looks like. So probably a young person on their first row out of school or college. And in fact, nothing could be further from the truth. So they can cover really senior level roles, like our managers doing their level 5 in leader in adult social care. And if you think that apprenticeships are anything from college leaver, care assistants, to postgraduate level management training, and I just don't think there's anything that screams more professional than studying a postgraduate in management training, for example. So again, it's that career path, it's that progression to say, I'm a care assistant, and in several years' time, I'm studying a postgraduate level in management training. And I think lots of professional services will promote and push apprenticeships at all levels. And I think that's one way to make the sector be viewed more professionally, is undertaking and promoting more apprenticeships across the sector.
Yeah, I think that's a great idea. And obviously the government are investing heavily in that area right now. And I guess the care sector can benefit from some of the general programs, but I'm sure more specific programs focused to the care sector would be incredibly helpful. Jay, thinking about people who are in work and they're in the care sector already, what's your kind of view in kind of thinking about their career needs and what staff are asking for in terms of like staying within a business and being able to grow their opportunity whilst they're there? What are you seeing?
Well, I think, you know, we've got to kind of separate out when you're in the job, what makes you maybe not stay, or what might put you off. There is a recognition of the importance of social care now, as we've touched upon, as Victoria just said there. You know, these are valuable jobs. These are really important, and I think society accepts that. But it comes to the point with Rodri before as well, that we've too often equated low pay with low skilled. We've kind of seen them as entry-level jobs. Maybe it's how we've all been brought up. We've probably all had jobs when we were 16, 17, in shops, bars, restaurants, relatively low pay, but we were told you don't need no training, you don't need no support. And we've almost put social care in the same bracket. And I think that's part of the challenge in attracting people in the first instance. I think the report touches on lots of this. People leave, they want to leave jobs, but they do, as you rightly point out, John, stay within the sector. They do want to stay within social care, so they clearly value what they do, but half leave for higher pay, half leave because they don't feel valued. 46% said they want a less stressful working environment. And if you look at the latest skills for care data, the pay gap between those working in care and those maybe working in bars, restaurants, shops has closed, or as in some cases in shops has gone past the median pay for care. And I think that, you know, that's in the skills for care data that they publish. And I think if you're a person looking for a job now, a young person particularly, and I think we should be heartened by young people considering a career within social care, they might be thinking to themselves, well, if I've got these negative perceptions, why would I go and do that job when I could just go and do the, you know, work in a shop and, you know, leave me problems behind at 5 o'clock when I finish kind of thing. I don't need to worry about what I might experience in that job. So I think that's an issue for people. High turnover rate is high amongst younger people, but, you know, there are opportunities. I think if we get people in, that rewards them for the job they do, and that isn't just pay, but pay is really important. Pay is, you know, 73% are paid below the real living wage. But, you know, making sure they get the rest, making sure they get holidays, making sure they have secure work where they can. Just under 1 in 4 people in social care work on a 0 hours contract. These are issues people not feel, and these have all come up in the report. This is nothing new, but people saying these are reasons why they are maybe put off. And I think we need to have a conversation about, well, what is the job? And that's where I come back to that NHS comparison. You know, I've worked in the public sector, I've worked in the civil service, I've got friends who work in the NHS. People in some of those jobs will accept it's not going to be the highest paying job in the world, but there is a relative level of security from that. And I think what we should be looking at, you know, the people Victoria works with, those who Rodri works with, is what are the good examples from employers where, how can we maybe make a business case for some of this? Not just government putting more money in, which is really important, but how can we make a business case that we can improve retention rates when we pay a bit more, when the gap between the highest paid and the lowest paid in the sector, you know, the experience pay gap in social care has fallen. It's 12 pence an hour on average. You know, if you've worked there 5 years, you're only paid 12 pence more an hour. I couldn't say that I would feel confident carrying on working in a sector if I didn't feel like my experience and, you know, loyalty was being rewarded. So how do we fix some of those challenges? But they're all there. What I think this report really does well is it highlights them, and then it says to us all, what do we do about it? And I think it's, you know, calling on employers who are doing the right thing to say that, to show that, you know, we are in a really interesting point you talk about in the wider labour market, where there is, you know, there is pressures on wages, which is coming from, you know, not a lot of people working in hospitality at the moment. We're seeing stories where hospitality wages are being driven up because there's a demand. The same should be happening in social care. There are 112,000 vacancies, as you rightly point out, and a high turnover rate. How can we get that same pressure on wages that comes up ultimately, and acknowledge this? And, you know, Victoria, the people Victoria and Rodri and others work with would rightly castigate them if they didn't raise it, so I'll do it on their behalf. That comes from funding from those who commission social care, the money that people who receive direct care can pay towards that, and what government ultimately puts into this. And I think government has an important role in it. But are the lessons within the sector now we can learn from about where this is really being done well? Because it clearly is. Lots of people leave and go and work somewhere else in social care, and they stay. And there's lots of people who work in the sector for a very, very long time and have really fruitful careers. What are those good examples where people are being rewarded and acknowledged and feel there's a recognition, and recognition comes in pay and terms and conditions, but, you know, the stuff we've seen today about burnout, and acceptance that the work I do is important, but that the work I do is valued by those who I care for and those who I work for as well.
Well, I think that's a really great segue. As you were talking, and there's this piece around salary and paying people fairly for the work they do, but also all of the things that are additional to salary. And an unrelated stat that might be useful is in my business, we see the application rates for adverts increases by 20% when you list 4 or 5 non-financial benefits of working there. So it really matters to people. It's like, okay, I see what the money is, whatever that is, either a good thing or not a good thing, but actually all of these things mean something to me and they're really, really important in terms of my work-life balance or what I care about. And I think we should never ever shy away from the fact that actually these things are really important. And as I say, we see it in the data in general, and I'm sure it's equally acute in the care sector. But Victoria, one of the things that comes up a lot in this survey is about feeling valued. Obviously, it's a real reason why people are considering leaving, and it's the highest reason that after they've gone, why they say they left. So it really, really matters. What's, you know, from someone kind of living in this career all the time, what are some practical advice that you might offer people to help steer them and think about this as an issue for their teams and how they can improve?
Yeah, sure. So I think the most important factor we should really be considering is that we need to listen to our colleagues and really give them the opportunity to tell us as the employer how they're feeling. And we know that when people are listened to, they feel valued, and it seems simple, but I believe it makes a really great difference. So some of the kind of initiatives that we've employed a lot of resource and time into is exit interviews. Really trying to understand we have a lot of homes across the country, from kind of Scotland all the way down to the south coast. So really trying to understand on a site-by-site basis why people are leaving. And although these people have left, people feel valued when they're listened to and when they have the opportunity to speak. And actually what we found is that when people often come back if they're treated in such a way. And so really on a kind of individual basis, we're speaking to each and individual employee that is choosing to leave and trying to understand why. And that in turn kind of helps shape any new initiatives that we can around retention. And then to flip that, not only looking at people, why they're leaving, but why people are staying, why people are joining your business. We really need to speak to our colleagues and flip the exit interviews and look at stay interviews. So why they joined, why they're choosing to stay, and then really promote that across our business and also externally. So we do a lot on our social media networks to try and raise awareness around all the great reasons why people are joining and choosing to stay. I was on a webinar the other day and giving someone their 25-year service certificate in recognition of 25 years in one home. Now, that's really fantastic. And I think Jay said there are people choosing to stay, and we really need to understand why. And speaking and giving them that platform to tell us, I think makes people feel really valued. And another thing to consider there is not everyone does feel comfortable raising concerns or talking to their line manager or people within their home. And so we need to give our colleagues opportunities to provide feedback at a different level, at a more senior level. So as an example of how we've done this is we've created the role of a colleague voices rep. A representative of each home. So each home will have a colleague voices rep, and they'll be invited to a regional colleague voices forum. So each of the homes will be given feedback from the home, understanding issues in the homes, things they're disgruntled with, things that are going really, really well. And they'll attend a regional meeting with our regional directors and have this forum to talk amongst colleagues and senior managers about things that are going well and not going well. And then to take that one step further, we'll host a national colleague voices forum twice a year, which is attended by our CEO, our HR director and operations directors. And the feedback at these events has helped us shape development programs, our induction. We've initiated welcome training. So what does a great welcome look like? Our recognition programs, career development. That's all come from our colleagues. That's not initiatives that as a support centre we've come up with. Our colleagues feel valued. They're the things that they want. They're not the things that as a head office we implement. And I think the best way to get colleagues to feel valued is giving them the opportunity, whether it be exit interviews, stay interviews, forums, to tell you how they're feeling. Because if you don't know, how can you make the changes that are right for them?
Yeah, I think everything that you mentioned there is incredibly valuable, and clearly when you put listening at the heart of how you run the business rather than just, hey, we should listen more, I think you're getting real value from that, and I can see how gives an opportunity to make sure that people feel heard. And I think certainly, and just in my general experience, if people feel like they can contribute to how the business is run, how changes are implemented, what changes actually happen, then it really leads to a workforce that is engaged and trusts that their voices are not only listened to, but where appropriate, action is taken too. There's nothing more powerful than that. We're running up against time, so I'm going to pause here for a second. Charlie, who's looking after us technically in the background. Charlie, are there any questions that have come up through the call that you want to put to our panel? If not, I'll give people a chance to have some final thoughts.
Yes. Hello. So a couple of questions that have come through. The first one here: beyond additional funding, how can employers be further incentivized to provide training for their staff?
Who wants to take that? Rodri,
I'll go. Yeah,
sure.
I think it's about obviously we know the funding is extremely tight in some parts of the sector, and I think it's about providing evidence that investing in training is actually value for money, and it actually contributes to the longer term sustainability of the sector. And I think reports like this one are therefore really important in terms of emphasizing this, because I think we can say all of this but if we don't have the evidence for finance directors when they're making decisions, especially in the context of underfunding, and I think also it's about having supportive external bodies who emphasize training as well. So you only have to look at the likes of Skills for Care. So I think Skills for Care's annual budget is 26 million, whereas Health Education England's, it goes into the billions. And I think that's just one example that shows the lack of parity, both in terms of economic funding, but also in terms of how, because governing is about priorities, and the government has chosen, governments of all stripes have chosen not to prioritise Skills for Care, and have instead gave an unimaginable amount of more money to Health Education England. And I think that's really detrimental in terms of how the sector is viewed. So I think there's lots of different things we can do, but those are just two that came to mind.
Yeah, it sounds like, there's this thing is it people on the ground spending all of their time firefighting, then it's really incumbent upon the management and organizations to kind of go, actually, what is the value of my team not firefighting, as people leave and trying to cover, particularly as we've seen in the pandemic where people have been self-isolating, etc., puts a lot more pressure on the rest of the team, and making sure that training and recruitment is there as a critical facet. Victoria, I saw you just about to come in there. You have something to add.
Yeah, I think it's actually a really interesting point, because I know lots of businesses invest in recruitment, whether that be job boards like Totaljobs or like lots of other methods, internal recruitment teams, etc. But there's a lot of money to invest in. But to flip that, investment should be made on retaining people. Businesses are willing to foot the bill in terms of job boards and internal recruitment teams to fill the gap. But it's that leaky bucket syndrome if we're not willing to invest in retention, which are things like training. And there's some really great evidence to say that providing kind of training opportunities, which in turn leads to career progression, it's filling those holes in that leaky bucket, and therefore less money spent on things on the upfront part. And so I think it has to be really balanced, instead of large proportions of budgets being spent on the front end recruitment piece, which I think is essential. It's actually looking at it in a 360 view and looking at how you could support that retention, rather than just throwing a lot of money to get people in if the holes in the bucket are still there.
I think you're spot on. It might seem like a turkey voting for Christmas for me, having the same opinion, but very much trying to understand the profile of a successful employee in a business, and also when people leave, where do they go, so that businesses can work on those issues to retain. it's probably the only area where from data we can help our customers. But you're 100% right. I think it's easy to see the finances of having a gap in your business. And Rodri, I think you called this out, is understanding the value of the ROI of training, if you like, you know, and being able to have a conversation with a finance director or a CFO that puts it in pound, shillings and pence there. Because Victoria, I think to your point, you can easily see the need to hire someone and invest in a job board, but actually, you know, stopping the person moving out the other side is obviously what builds a much stronger business. So I think we're pretty much there on time. I'm quite happy to throw it out there for you guys. If there's anything that threw up in the report for you that you maybe didn't get a chance to talk about, then I open the floor. Feel free to jump in. Nope, all good. Rodri, Victoria, Jay, Melanie, thank you so much for being involved, for being a panelist today. Melanie, thank you so much for taking us through the report. And to all of the people who are working behind the scenes to pull this together and to make sure that we've got something that we can take meaningful action from a job board like ourselves to an employer for a single care home or a large business or a consultancy, a recruitment consultancy. Like, you know, I think there's lessons that we can take from this and support the industry, support customers, support candidates coming through. So really appreciate the investment that you guys have made. So thank you so much. Right, and have a great rest of your day. Thanks everyone for joining.